Moving on to the final section, the management plan. Now, the ISCE criteria state that the student should have a clear, precise, negotiated management plan. This should be a full plan with sequential interventions. Another student tip, very similar to what we've mentioned a couple of times already in this video segment, is that one should find a way of classifying the management plan. So, for example, here you could start off with conservative management, talk about modifying risk factors and also general lifestyle. Then one could move on to the medical management, and within this one would include drugs as well as other non-surgical interventions. And then finally moving on, if applicable, to surgery. Now, the ISCE guide also mentions that when talking about treatment, the student should know the benefits and side effects for the treatment that he's talking about. At the same time, one should have knowledge of alternative options, if applicable. One particular tip that one student gave in remembering knowledge of particular drug classes was that when you're talking about a drug group, have at least one example of that type of drug, and also just one brief sentence regarding its pharmacology, and also just a couple of the common side effects. Now, the BMA also suggests that students should be aware some examiners may be looking to assess safety, and they will do this by asking questions around common surgical or medical emergencies, such as acute asthma, COPD exacerbations, small or large bowel obstructions, or diabetic ketoacidosis. So just generally have an idea about how to address these type of topics. And just one final word when it comes to talking about the management is that you should be aware of the terminology that you're actually talking about. And what I mean by this is, for example, when you're referring to moderate asthma or severe asthma, you should have an idea, or you should know exactly what you mean by these terms moderate and severe. And actually, there's not many diseases other than cancer that have defined stages. Some of the common ones include asthma, pneumonia, and ulcerative colitis. So you should have a general idea about these stages and also how what the implications are for the treatments. And finally, on this section of the management and generally presenting your case, we should talk for a little bit about the impossible question. We've all been there. How exactly would you handle a question that you have no idea about how to answer? Well, first thing is, don't panic. You could always go back to basics, especially if it was to do with, for example, management. You could always go back to ABCs. You could always say that you treat the symptoms and that you would seek senior advice. Now, some assessors may wish to prod further and ask you specifics. And in this case, you could be in a situation where you don't quite understand the question and the answer that is needed. And if that's the case, just answer a few general points around the topic in general. And hopefully the examiner may be able to clarify further what he or she meant. If you do understand the question and you just don't know how to answer any further, then just say so. It's better than umming and erring, because at the end of the day, that's just going to waste time. And if you just say that you don't know, one, it shows integrity, and secondly, you'll be able to move on to something else, which hopefully you should be able to answer a lot better. And one final word, just practice plenty for every part of the ISCEs, and just to reiterate, do everything systematically, whether it's the history, the examination, or presenting, answering questions. Make sure you have a good system, and it would be the start, and all you need to do is fill in all the gaps with your knowledge. And apart from that, good luck.